That's fine. Well, good morning. Thank you, and welcome to the Department of Public Safety. My name is Bruce Gordon. I'm the Director of Communications for the department, and we welcome here today. We have some very good news to share with you regarding the number of Minnesotans who have selected organ, eye, and tissue donation on their driver's license or their state identification card. You're going to hear from a number of people today. First of all, Mona Doman, Commissioner, Minnesota Department of Public Safety. You have the spelling on your advisory. If there's any question, please let me know. Susan Gunderson, the CEO of LifeSource, who is representing the consortium of organ donation agencies. And also Senator Dave Senjem, who will be speaking for a few moments, whether you like it or not. Yeah. Was kind enough to join us. Senator Senjem was very instrumental in the U&2 program, and we'll talk about that in just a few moments. Also, someone who knows and understands the value, the very valuable gift of organ donation firsthand. You're going to hear from Hallie Anderson, who was a liver recipient. So we'll begin with Commissioner Doman.
Thank you, Bruce, and good morning. Welcome to the Department of Public Safety. We are just delighted that you could be with us here this morning. We have some really important and exciting news to share about the growth in donor designation in Minnesota and the success of the U&2 program. As you all well know, because you work with Minnesotans, we've been long able to check a box on the driver's license or ID card application to elect to be an organ, eye, or tissue donor. The Department of Public Safety partners with the state's 3 donation agencies to call attention to this important life-saving decision and encourage Minnesotans to check the box. So we appreciate working with LifeSource, Minnesota Lions Eye Bank, and American Donor Services for the important work that they do and for raising awareness about the issue. They truly make a real difference in the lives of our neighbors and our friends and our families. Just this morning, I met with the family of a young man who was killed in August in Oakdale as a result of distracted driving. But one of the things that brings comfort to his family is that he was a donor, and he had made that choice prior to passing away. And he has impacted the lives positively of at least 60 people in the state of Minnesota, and so that brings them peace and comfort. I'm also proud to say that I'm a donor, and I am also proud to say that I have a lot of company. Since 2010, Minnesota has added 300,000 organ donors, which is a 13% increase. That means nearly 2.6 million people have documented their donation decision on their driver's license or their ID card. Minnesotans are generous and they're caring, so we shouldn't be surprised that nearly 63% of us are registered as organ, eye, and tissue donors, which is compared to 45% nationally. In 2012, the Department of Public Safety, with the support of LifeSource, Minnesota Lions Eye Bank, and American Donor Services, were able to add another checkbox to the driver's license application. The U&2 program gives Minnesotans the opportunity to contribute $2 to organ donation education. We are proud to say that Minnesotans have contributed nearly $110,000 to this program to date. Because of the U&2 program fund, the state's 3 donation agencies were able to develop a new curriculum to educate Minnesota driver's education students about the importance of organ, eye, and tissue donation. Every year, more than 57,000 people go through driver's education programs, and the vast majority of these people are our teen drivers. When they receive their driving permit at the conclusion of their course, they are faced with the decision to register as an organ, eye, and tissue donor on their application, probably one of the first adult decisions that they get to make. In addition to the collaboration between our state's donation agencies, this new curriculum was developed in part by the teens. And at this time, I would like to introduce Senator Dave Senjem, who is here to share just a few words with us, as he was the chief author in 2011 of the U&2 legislation. Senator Senjem.
Thank you, Commissioner. I was looking at my calendar last night and thinking about, well, okay, what's going on today? And albeit there's a lutefisk supper and dinner in Casson, Minnesota, I decided to forego that. Just kind of looking at and thinking about my legislative life a little bit. You know, okay, Destination Medical Center, University of Minnesota in Rochester, wonderful things. But I dare say that when I fulfill my role as a state legislator, and when I look back at this, this organ donation bill brought to me by Susan, I mean, you know, it's just kind of the grace of God to help people walk in your office and give you opportunities. But this was an opportunity that I had to work on a bill, got it passed, that I think going on into the future, and we all know this, tremendously meaningful bill, and what it does for people and what it does for families. And I think so much, maybe a little over a year ago now, out on the at the airport here, Governor Dayton, myself, and a few others were going to Duluth to look at their flood. And I got this call. Denny Hansen had a full-blown aneurysm and probably isn't going to make it. Denny was the council president in Rochester and a dear friend. And Denny didn't make it. But I think we're all maybe, as we think about Denny, and we do fondly in our city, think about the fact that Denny's life does live on somewhere with someone, and maybe more than one, as Denny was a donor, and there was time to harvest those organs, and so he lives on. And so these kind of things give meaning well beyond highways and buildings and things like this. This is directly something that affects patient lives and the lives of families going forward. So Susan, thank you. I'll be forever grateful that you walked in my office that day, you and several others, and gave me this opportunity. And I just wanted to be here today to see this thing as it continues to unfold and develop within our state of Minnesota. So again, thank you, and thank you, Commissioner.
Thank you, Senator Sinjum. We so appreciate your support and the work that we get to do with you at the legislature. And at this time, I would like to introduce Susan Gunderson, the CEO of LifeSource and the representative of the organ donor agencies, to speak more about the education project. Susan?
Thank you, Commissioner Doman. It's really a tremendous pleasure to be here today, and we're very grateful for the opportunity to share the stories of donation and transplantation that are so powerful and so wonderfully told here in Minnesota. I'm proud to be here today on behalf of the donation agencies to introduce and unveil the new campaign for driver education in the state. Named the Make Your Mark Organ, Eye, and Tissue Donation, the curriculum is designed to provide education to students about organ and tissue donation when they're participating in their driver education training. This is a tremendously exciting day to have the opportunity to unveil this new program, and we're very, very proud of the results of this project. As you will see, it's quite incredibly, quite touching, quite powerful, and quite inspirational. The goal of the program is to provide resources for education at driver education training across the state. And it highlights and focuses on 4 teenagers from our communities, 4 teenagers from Minnesota, who have been touched by donation and transplantation. A little over a year ago, LifeSource, Minnesota Lions Eye Bank, and American Donor Services began a collaborative effort to develop this new program. We are so excited that this program will save lives. And we know it would not be possible without the generosity of Minnesotans and our state leaders. I want to also thank Senator Sinjum for being here today. He immediately said yes when I walked in the door and said, I have an opportunity. How would you like to help us out in promoting this cause? And we're very, very grateful for your support. Thank you very, very much. It's made a huge difference today and will going forward for our citizens in the state. This new campaign was funded by the UN2 Fund. This opportunity, established in 2012, creates the chance for people to provide a $2 financial contribution at the time they're renewing their Minnesota driver license, identification card, or motor vehicle tab. You've heard from the Commissioner about the results to date. Minnesotans are generous in providing financial support to help raise education and awareness for this important cause. We are also extremely proud that Minnesota was only the second state in the nation to introduce legislation that requires education about organ, tissue, and eye donation as part of the driver education curriculum. We led the way in that campaign. And now we are also leading the way with the UN2 campaign to provide financial support for the education programming. So as we started this project, we really wanted to create a curriculum that speaks to teens, that is important to teenagers and that resonates with teenagers. We decided we needed input from teenagers in helping the process come to life. So we reached out to Purpich Arts High School and their media arts students to help provide some guidance for us, to help design what works for teenagers today, what speaks to them, what will touch them. We engaged Eliza Leonard, who's here with us from Purpich, as an intern who worked on the project and provided really excellent expertise and guidance in curriculum development, in filming, and in editing of the process. Thank you, Eliza. Appreciate your help. The students told us that they wanted to hear authentic stories of other teenagers. They didn't want actors, they didn't want people from Hollywood. They wanted local citizens from across Minnesota who have been touched by donation and transplantation. That's what these stories showcase. They also told us that the curriculum should be designed so that teenagers are empowered to make the decisions themselves. As you heard from Commissioner Doman, choosing to be a donor is really one of the first legal decisions students can make, young people can make. And developing the curriculum to empower kids to make those decisions is what we have done and what we think will resonate with the students. So now we are unveiling this new curriculum, which is so exciting, but we're incredibly grateful for the support from the Department of Public Safety. It is the staff and the personnel who day in and day out help deliver this message to the clients who come through the driver's licensing exam stations, providing information to their customers, providing a process to check the box, to make your mark, and to fulfill the donation wishes and decisions. So we're incredibly grateful to Pat McCormick and your team for all of the work that you do day in and day out in helping us advance the message of donation. For this particular campaign, we would also like to notice and recognize the staff at the Egan driver's license offices who allowed us to film part of the video in their space. And I'd also like to thank Don Hakst, who manages the driver's education instructors and helps us bring this program to instructors totally across the state. So we're very, very grateful for that outreach. As you heard, nearly 63% of adults in Minnesota are registered as donors, far surpassing the national rate of 45%. But we can do more. This program is about doing more. Teenagers are leading the way, and in fact, teenagers are signing up at higher rates than other citizens across the state. I know we can do more, and I firmly believe that Minnesotans, if given the chance to save a life, are going to do just that. This campaign, the Make Your Mark campaign, inspires Minnesotans to check that box and make a difference. But the reality is, even with the strong support for donation that we have right now, the need continues to grow. There are far more people in need of an organ transplant than there are available organs. Sadly, 18 people die each day simply because an organ did not become available in time to save their life. I often say that transplantation is the ultimate intersection of high technology and high touch medicine. The science to restore sight, to heal the skin wounds of a burn victim, to replace an ailing heart, are indeed medical miracles. And there are no medical centers in the country better than those right here in Minnesota that make those miracles happen every single day. But none of that high-tech medicine ever happens without the generosity of people like you and me, who make the decision to help others at a time of loss. It is that gift, it is that community of caring that makes this all possible, and we're incredibly grateful for those gifts. The new driver education campaign will showcase and highlight the stories of teenagers who've been touched by donation and transplantation. And now I'm very proud to introduce to you the mother of one of those generous teenagers, Princess Titus. If you could please come forward, Princess. Thank you very much.
Well, hello, my name is Princess, and I am the proud mother of 3 children, Anthony, Jesse, and Princess Anne. the reason why I'm here today is because my son Anthony Titus, his life was taken on the 4th of July, right before the fireworks, by gun violence. He died instantly, and that makes me sad. The 16 years and the 2 weeks that Anthony lived is where I find my memories and my happiness. Also, there was a certain time where Anthony talked to me about getting his ID and saying, "Mom, what's a donor?" And I said, "I don't know. You should ask the people at the place. Is that something you want to do?" The conversation never came up again. But then after Anthony passed away, which was like a month after choosing to be a donor, I remember getting a call from Helen Nelson, the nicest woman at LifeSource, and just the comfort that she shared through the phone just made me feel like it wasn't just such a bad situation after all. And then she said, "Because your son was a donor, we're calling you. He's going to be donating gifts that are going to give other people life." I'm really appreciative of the people at LifeSource. Just the way that my son left this earth and how he lived his life makes me happy. And it seems like that one sad part about him being a victim of gun violence just takes me to a depth I can't return from. But then I get a card in the mail, or I get a call from Rebecca, or I get an opportunity to do something like this and have my son's story told to encourage other youth, other grown-ups, to be donors, to let your life live on. I'm so grateful to Helen. I'm so grateful to Rebecca and all the people in LifeSource. I'm also grateful to my son that still lives here because he tells me, "Mom, we can do this. We can do this. We can do this." And my brother can live on. And I feel like through LifeSource and through his donations, other people get the gift of life. So I'm down with I Am Hope, and I am also a donor because of Anthony. Thank you.
Thank you, Princess, for the incredibly touching words of healing and words of inspiration. We really, really appreciate your being here with us today and all the stories that you're sharing about Anthony's life. We appreciate that. It is now my pleasure to introduce someone who's been touched by transplantation, donation and transplantation. Hallie Anderson is a young girl who received the gift of life nearly 5 years ago. Pleased that she's here with us today to be able to share her story. Hallie.
Hi, my name is Hallie. I'm 16 years old. When I was 11, I was diagnosed with liver disease, and they said I wouldn't make it without a donor. This directly impacted our life, and I was really lucky, and a few weeks later, they had a liver for me. I was one of the lucky ones. Not a lot of people get it in a few weeks. A lot of people die on the list waiting for a liver. This was a bittersweet moment for me because I knew that someone had to die for me to live. But it gave me hope that other people out there still wanted to be a hero when they weren't there anymore. My donor was Kayla. She was a beautiful 17-year-old girl. She had tragically died in a car accident. And I constantly hear that she's an amazing person, and I know that she was an amazing person because she decided to keep her legacy going by donating her organs and saving lives even when she's not there anymore. Her actions have inspired me to do good in the world and try and speak whenever I can. To spread the word about organ donation and carry on her legacy. It's so important for young people to learn the significance of this and the importance of this topic, because without it, you can't save as many lives as you could. If I really wanted to be in this video because I know that it will actually have an effect on the youth that are watching it in the driver's ed classes. I feel that they will feel more serious about donating their organs, knowing that there is someone out there like them who's been through it and has been saved by it. I really wanted to be in this video just to carry on Kayla's legacy. If I inspire one person to donate their organs through this video, my mission will be complete, because I want to be the hero that Kayla was to me. Thank you.
Wow, it's hard to follow that. I would just like to recognize the staff at Driver and Vehicle Services Division here at the Department of Public Safety. Pat McCormick is the director of the division, and she's got staff here with her today. They're always behind the camera, and they really deserve to have some recognition. And the partnership that we have with the Department of Public Safety, the donor agencies, and certainly the legislature can't go unnoticed. This is how we get things done. I'd also like to acknowledge the CEOs of our state's donation agencies, Jackie Malling from the Minnesota Lions Eye Bank and Richard Halliburton from American Donor Services. We appreciate their leadership and the work that they have done to date on this endeavor. And now we would be willing to open it up for any questions that you might have.
Commissioner?
Yes.
Donor program's been going on for a long time in the state, obviously. And sometimes people just kind of, they check the box and they think it's taken care of. And I remember somewhere in my past that you were tragically killed in a crash. You have donor on your card. I think a lot of people think that's the end of it, but is that just the starting of the process, or can they be assured that there really is, that their organs are gonna be used? Because I remember hearing about, well, they get to the ER and family can interject, things like that. So could you clarify again, because it's been so long process, once someone dies and they have donor on their gravestone?
I'm going to ask Susan to come to the podium because they work with that, the situation from that point on. Thank you.
Thank you for the question. So when you choose to become an organ and tissue and eye donor, you mark that on your driver's license. That is your decision. It is our responsibility to honor that decision where we can. Of course, donation only occurs after all efforts have been taken to try and save someone's life. So an individual would end up in the emergency room, would be treated. If those treatments unfortunately fail, that is when the donation opportunity would occur. We would be notified, and we would work to honor those wishes as best we can.
The question basically being that the family can intervene, change wishes of what dad wanted. He had no idea what he wanted.
Right.
That sort of thing.
Right. So it is your decision. It's an individual's decision, and we do work to honor those wishes. In most cases, the family is extraordinarily relieved that that individual has already made that choice, and they're able to honor that legacy. And we will work with the family to work through any concerns that they might have. I would just call attention to Representative Phyllis Kahn, who came forward here as well, and thank you for her support. She was very instrumental several years ago in helping us strengthen the Minnesota legislation to truly affirm those decisions of the donor. So we're grateful for that as well. Thank you for being with us.
Any other questions?
Sure, if you'd like to give us an idea, like right now, roughly in the state, do you have any sense of numbers of people waiting for organs, hearts, livers? Give us a little hits, runs, and errors of
Okay,
Just
so
off the top of your head.
top of my head, 3,000, is that right? That's the number I'm looking to my staff in the back. Most of them are, about 3,000 people in our Minnesota are waiting for transplants. Most of those are waiting for kidney transplants, but certainly all of the other organs, of liver, lung, pancreas as well, are heart patients are waiting every day. Kidney patients have the opportunity to continue to live on dialysis, so they have a backup, if you will, but it is a life-saving event to get them off of dialysis as well.
So, like a liver transplant, J.B. Fisk was like one of the first ones. There was a grand thing around the world.
Right.
Have they become routine organ transplants?
Transplants are highly successful. You just heard Hallie's story. People do very, very well following transplant. I wouldn't say there's anything routine about this life-changing event. Again, people do extraordinarily well. It is rare. It doesn't happen enough. There are so many people that need transplants. I can tell you that we, again, are fortunate to have leaders here in this state in transplantation of all organs. Jamie Fisk, as you mentioned, was a transplant at the University of Minnesota. Mayo Clinic has been a leader in transplantation. Hennepin County has had a kidney program for 50 years, did extraordinarily well, and Abbott Northwestern as well. So it's still high-tech medicine, still high-tech, very complicated medicine, very strong results.
I too would like to recognize Representative Phyllis Kahn, who just joined us, and ask her to come to the podium and say a few words. And then if you have any more questions after that, we'll open it back up. Thank you.
Well, the first thing, getting here was an intelligence test that I failed. So I apologize for being late. There is one